Hi, this is the educational presentation by Delta 9 Medical Consulting. I gathered the information from a variety of sources across the internet. And as such, I make no claims that it's original content, and in fact, this entire presentation can be shared freely. However, I understand that some authors or artists would like to claim their information as their own, and if they would like to, they certainly can contact us and be happy to remove it from the presentation. However, it is presented here under the use of the fair use doctrine for educational purposes. Furthermore, the show should not be construed in any manner to represent medical advice. You're able to review some of the basic ideas that surround strain selection. In my opinion, it's not scientifically based, it's just based primarily on my experience, and was developed as a guide to help you when you go to dispensaries. If you looked at any guide or any magazine or on the internet or talk to people at dispensaries or other patients or friends, everybody likes and has their favorite strain. And it seems that the number of strains out there is just really hard to fathom when you're a new user, or if you're a grower. I mean, it has to be frustrating because the different names, you may consider what you have one name and you find that someone else is growing the exact same thing using a different name and is trying to make money out of that. So let's discuss what's behind that. If you're new to cannabis, it's important to know that really when you go to a dispensary, just trying to lessen the amount of intimidation that you may feel. You don't have to start from scratch or look up Professor Snoop to give you some in-depth education. You also don't have to feel that you're dependent upon the bud tenders, the ones working at the dispensary, for advice. Instead, you'll have a good firm basis for deciding the type of cannabis in general that you're looking for, so that you get the effects that are desirable and hopefully lessen the undesirable effects for you. When you go on the internet or you look in other guides that purport to demonstrate a variety of strains, you'll frequently see tables like this. I mean, this is the B strains and some of the strains that start with the letter C. It's just overwhelming. I mean, right now there are well over 5,000 different strains. And where does a patient begin to look? Often in dispensaries, frequently on the West Coast or in seed catalogs, they'll have graphics that show strains in this fashion, when under each strain are unique characteristics. However, are they really that different? I mean, are the differences that subtle so that a panel who was blinded to the herb would be able to reclassify them in these categories? I mean, I don't know the answer, but I think it would be very unlikely. When you have an underground product like cannabis, the standardization and naming conventions aren't there. So the farmers that even pay close attention to this and have documented it carefully in notebooks and kept track of their crosses, and these guys are out there, unfortunately, aren't really adhered to in any standardized fashion across the world. Therefore, there isn't a panel of scientists looking at cannabis and classifying it into the variety of strains or assigning the names. That's why they're so unique. Sometimes a single individual has a cross in their basement and they give it a name and promote it at cannabis cups, etc. And there you go. There's a new strain. There are celebrities out there, Marley Natural, for example. You got Willie Nelson with his own strains. Snoop Dogg has his own strains. Whoopi Goldberg has her own strains. I mean, I'm sure it could go on and on. You get the idea that you can just about name any plant, anything, and there's no liability or product infringement. So it's really buyer beware, in this case, patient beware. This is a complex slide. What it demonstrates is that when you look at the variety of different chemical concentrations in cannabis strains that were submitted to a laboratory in Southern California, that there is a significant degree of overlap. If these strains were indeed different or unique, as the strain guides would present them, you would expect no overlap or a sizable amount of separation. However, it is particularly in the center, little variation in the chemical composition found in the samples that were submitted to the laboratory, therefore suggesting that the uniqueness of each plant is not as reported by the grower or the dispensary networks. Well, the industry really likes to make it complicated for people that are new to it or not involved. They'll make it as though there's a complex interplay of cannabinoids, terpenes, flavonoids, and this ratio of these variety of compounds can cause different reactions in individuals. There may be something to that. I'm not saying there's not, at least in part, that could be true. However, I don't think the degree of variation that you can find on strain guides is practical when it comes down to patients selecting strains for their everyday medical needs. I like simple categories and a straightforward way of thinking when it comes to selecting medicines or classes of medicines. I found it helpful in my professional career to do things that way. It would be nice if all marijuana was the same. However, pot is not pot. In fact, about 80% of my patients are able to distinguish between different varieties of cannabis that we'll discuss further. Maybe about 15% are not as apt to notice differences, but they do notice that some strains cause perhaps a little stimulation and other strains are maybe a little bit more sedative. The trouble with the underground market, you just never know what you're getting at times. And the effects from the cannabis are often related to factors that would influence how you feel that are actually outside of the effects of the cannabis itself. Well, this is really a breakdown of marijuana. The cannabis sativa is commonly called sativa. The cannabis sativa indica are referred to generally as indica. And then ruderalis is not even discussed in most circles. Ruderalis is thought of as a ditchweed. Traditionally, people would call it hemp. It was good for erosion control, but if you smoked it, it basically would give you a headache. So we're going to learn a little bit more about the indica and sativa categories, and ruderalis does play a part also. We'll discuss that in medical cannabis, even though ruderalis does not produce THC in any appreciable quantity, and therefore you cannot achieve psychoactive effects with ruderalis. At least this is a way of categorizing it so that you can better talk with dispensaries or your providers about what effects you're looking for. So all of these varieties here, sativa, hybrid, and indica, will help with appetite. They can help with pain. They can help with nausea. So when you see charts that it says one type is better for this or the other based on indica, sativa classifications, I don't find a lot of confidence in an author that would write that. Likewise, when they state that one classification, either indica or sativa, has higher levels of THC, this just is not validated with the current strain libraries that are out there. So let's go down this chart, starting on the left-hand side with sativa. Sativa, that's not what a sativa leaf looks like. They're actually, the narrow leaves are associated with sativa. But in any case, it does cause one to feel energetic, perhaps more of a head sensation. On the street, it'd be called a head high. You can become very social, perhaps laughing and enjoying oneself. A little ability, thoughts are a little bit more organized. Say creativity would be somewhat enhanced with sativas. Sativas are also known to be, in new users, somewhat tricky to accommodate to or acclimate to, rather. They can cause you to hallucinate, paranoia, anxiety, dysphoria. So let's keep that in mind if you suffer from any form of anxiety or bipolar disorder when you're selecting cannabis, particularly for your first few months of use. On the other side of the chart, over there on the right-hand side, are indica, and that should be the fat leaves, not these thin leaves. Indica strains are going to be sedating, relaxing. They're going to typically be associated with marked pain relief. The side effect, though, is couch lock, and you just become very tired when using indicas. Like I said, 80% of my patients note these type of effects. People have bred indica and sativa strains together, and the result is considered a hybrid. Likewise, they've bred other strains that are hybrids with hybrids, and these beget even more hybrids. So there's just an intermixing of the genomes of several different types of cannabis. The hybrid strains are really can have a variety of effects, typically pretty good pain relief without the same degree of sedation associated with an indica, and at the same time make good head effects, however, without a lot of the downsides associated with sativa. Frequently, you'll see the hybrids labeled as hybrids with sativa dominance or a hybrid with indica dominance when you look for them in a dispensary. There's kind of a fourth category of cannabis. It's not going to be listed as such in dispensaries, and that's what we're going to talk about next. What if there were a type of molecule found in cannabis that had all sorts of medical benefits? I mean, that was antibacterial, inhibits cancer cell growth, neuroprotective, reduces blood sugar levels, reduces inflammation, relieves pain, relieves anxiety. It can slow bacterial growth. It suppresses muscle spasm. It's tranquilizing. It treats psoriasis. It's a vasorelaxant. Well, that molecule doesn't make you high. It's called cannabidiol, CBD. It has really been promoted aggressively over the last 5 years as a product that can indeed do all those benefits and at the same time keep you from being high. In fact, the state of Florida has allowed medical marijuana with the stipulation that it is only CBD-based strains to be grown. Wisconsin likewise has a CBD medical marijuana law, but they make no ability for people in that state to cultivate it. So CBD by itself is effective in some individuals. I've found in my patient populations that the elderly are most benefited by it. I find that individuals that do not want neurological or psychological compromise during the day can use a strain that is high in CBD to decrease the mental alertness, the trespass that might normally occur when using cannabis. And if there is a level of THC in there, the two chemicals seem to benefit in terms of effects for the patient while preserving more normal mentation. The difficulty in Massachusetts is finding a dispensary that sells CBD cannabis. There's one that has a great strain called Cannatonic that's about 20% CBD and less than 2% of THC. As you can imagine, there's quite a bit of demand for that, so its shelf life is very short at the dispensaries. You can, and I would suggest for new users, if they could get themselves some pure CBD, to have it on hand, so if they had too intense of a reaction with a sativa strain or any other strain that would cause any paranoia, anxiety, they could ingest or inhale CBD, and it would hasten the recovery from the marijuana that's causing those adverse effects. This is perhaps not widely known, but it's certainly validated because the CBD actually will bind the THC so that it doesn't combine with the cannabinoid receptor, the CB1 receptor, with as great affinity as it normally would. So CBD strains, I consider them strains. A lot of individuals will classify them as high CBD variants of sativa or indica strains. However, I'm not sure that the sedative and the energizing qualities are present as they normally would be in a THC only strain. I saw this graphic in a High Times magazine about a few years ago. It kind of showed what crosses were required to produce classical high CBD strains. Those are represented in yellow here. Some of this is available locally in Massachusetts. The others you may not see. The numbers of CBD strains has grown significantly over the past 2 years. As there more seems to be more medical utility for this than individuals who were controlling the supply of cannabis had anticipated. So you're going to find dispensaries having a broader selection of CBD containing strains in the future. Additionally, the ratio of CBD to THC will vary. You may find a common 1-to-1 ratio that would have kind of a more head effects than a strain that had more CBD present than it did THC. An example of a 1-to-1 would be Harlequin, and it's found at some dispensaries in Maine and in the local market places around Massachusetts. So I guess my advice for you as a patient is to go to a dispensary, base the type of cannabis you want to try on the side effect profile that fits your needs. So if you're looking for something to help you sleep or calm down at the end of the day, an indica may be a good choice, at least a good place to start. If you're looking for something at midday to give you a little extra energy or help fight fatigue or aid perhaps in relief of a depressive mood, a sativa may be helpful. These are just generalized guidelines. People have individual reactions to cannabis. I have people that have PTSD with anxiety, and they certainly benefit primarily from sativa strains. I have individuals that use sativa strains to go to bed at night. I heard in an interview of Whoopi Goldberg talking about indica strains, and she can use them throughout the day. So as I have alluded to several times, this is really just a guide to help you with starting out in your use of medical cannabis at dispensary systems. Hope you found it helpful.